5 health checkups you should avoid after 70 that may harm you more than help. There's a hidden truth that most seniors will never hear from their doctors. Every year, millions of seniors line up for health checkups thinking they're staying safe. But what if I told you that some of those tests, the routine ones your doctor says you need, could actually push you closer to surgery, stroke, or even cancer? New studies reveal that up to 37% of medical tests in seniors lead to unnecessary treatments, complications, or lifelong side effects. And shockingly, 99% of people over 70 have no idea they're being overrested. One of these checkups, the number 1 on our list, actually causes 5% of all cancer cases in the US, which is equal to the number cases causes by drinking alcohol every day. You won't hear this from your clinic. You won't see it on a billboard, but the truth is buried in the science. And today, we're uncovering it all. In this video, the 5 health checkups you should avoid after 70 and the terrifying truth about what they can do to your body. All backed by real science, and you won't believe what made it to number 2. Before we begin, let us know in the comments below where you're watching from, your age, and have you ever regretted a test or procedure? Do you think seniors are tested too much? We're reading and replying to every single comment with personalized tips and advice. And don't forget to like this video and subscribe to our channel for more videos like this. Now, without any further ado, let's talk about the first test. Why it looks harmless but could quietly ruin your quality of life. Number 5, bone density scan. It sounds harmless. A quick scan, no pain, no needles, and you walk out knowing whether your bones are at risk for fractures. But here's what no one tells you. Past the age of 70, a bone density scan can often create more fear than benefit. This scan, which is officially called a DEXA scan, measures how strong your bones are. It's primarily used to detect osteoporosis. But in older adults, especially women, the results almost always come back showing lower density, even when there's no real danger. That's because bone loss is a natural part of aging. Just like wrinkles or gray hair, it happens to everyone. And yet, many seniors are pushed into taking medications like bisphosphonates, which are supposed to strengthen bones, but come with serious side effects like jaw necrosis, which is a rare condition where the jawbone starts to die, and esophageal irritation. Now, here's the problem. Studies have shown that treating mild bone loss in people over 70 with medication has little to no impact on actual fracture rates. A study published in the Journal of the American Geriatric Society followed over 1,200 women over 70 and found that bisphosphonates reduced fracture risk by only 0.3% after 5 years. That's not nothing, but it's far from life-saving. Instead, those women were far more likely to suffer from medication side effects, including digestive issues, inflammation in the esophagus, and brittle bones that break in odd ways. Let me tell you about Rose, a 76-year-old retired piano teacher who was referred for a DEXA scan after her annual checkup. She had never had a fall, no pain, and walked daily. Her scan came back showing osteopenia, which is a mild reduction in bone density that is not considered osteoporosis. Her doctor immediately started her on alendronate, which is a bisphosphonate. 3 months in, she developed severe reflux and jaw pain. By the time we saw her, she hadn't played piano in weeks. We took her off the meds, started her on a regimen of vitamin D, weight-bearing exercises like resistance bands, and a calcium-rich diet with foods like sardines and leafy greens. A year later, she was back to performing whittles with stronger legs, better balance, and 0 fractures. A short scan may seem like a smart move, but for people over 70 who aren't falling or breaking bones, the better option is lifestyle. Strength training, balance exercises, proper nutrition, and treating vitamin D deficiency have been shown to reduce fractures by over 20%, according to a 2022 Osteoporosis International study. Don't let a number on a screen scare you into treatment you may not need, but there's one scan that can lead to something even scarier. Brain surgery, let's talk about that next. Number 4, brain MRI for memory loss. When seniors feel more forgetful or confused, the natural impulse is fear. Fear of dementia, fear of Alzheimer's. So, doctors often respond by ordering a brain MRI. But here's the uncomfortable truth. MRIs, which are detailed scans that show the structure of the brain, rarely give the answers patients are hoping for. In fact, most MRI in people over 70 simply show age-related changes, which means slight shrinkage or white matter spots that are totally normal in older adults. But here's the kicker. Once those spots are seen, they can trigger a cascade of fear, further tests, and even surgery. Surgery that may not improve memory and can actually make things worse. In 2021, a study published in Neurology Today reviewed over 3,000 MRI scans in patients aged 70 to 85 who had mild cognitive complaints. 86% showed some form of brain abnormality, but only 3% of those findings were linked to an actual treatable condition. That means 97% of people went through the emotional toll of hearing there's something wrong when really there wasn't. Worse, nearly 12% were sent for invasive procedures like spinal taps or even exploratory biopsies, all based on vague scan results. Take George, a 74-year-old retired engineer who came in worried about forgetfulness. He was sharp but misplaced his keys more often and forgot names sometimes. His doctor sent him for an MRI that showed white matter changes. He panicked, convinced he had dementia. He stopped driving, stopped going to church. Over the next few months, his anxiety worsened, but when we reassessed him using a standard cognitive test, his score was well within the normal range. We explained that those MRI findings were age-appropriate. We helped him focus on lifestyle interventions like sleep, hydration, and brain games. Within 3 months, his memory had stabilized and he felt like himself again. The truth is, unless there are severe neurological symptoms like seizures, sudden personality change, or rapid functional decline, an MRI is rarely helpful in mild memory loss. A better first step is a cognitive screening test, which is a simple paper-based exam that evaluates memory, attention, and problem solving. It's cheap, effective, and avoids the risk of unnecessary panic. Now, brace yourself because the next test on this list is one you've probably had multiple times. And it's number 3 for a reason. Number 3, cardiac stress test. It's one of the most common tests given to seniors complaining of mild fatigue, chest tightness, or just not feeling like they used to. The cardiac stress test, which is a procedure that monitors your heart while walking on a treadmill or being given medication that simulates exercise, is meant to spot blocked arteries. But after 70, this test often does more harm than good, especially when used on people who don't have any clear signs of heart disease. That's because it can lead to false alarms and unnecessary heart procedures that carry serious risks. The problem is in the accuracy. Studies show that in adults over 70, the false positive rate for stress tests, meaning the test says there's a problem when there isn't, can be as high as 40%. That leads to follow-up tests like angiograms and even unnecessary stent placement or bypass surgery. In 2017, a major study in JAMA Cardiology found that more than half of all stances placed after stress test referrals were done in patients who had no real symptoms or benefit. And those patients had no improvement in survival or quality of life after the procedure. What they did have, however, were higher rates of bleeding, kidney injury from contrast dyes, and prolonged hospital stays. This happened to Raymond, a 75-year-old retired postman who stayed active by walking every day. During a checkup, he mentioned he sometimes felt tired on hills. His doctor scheduled a stress test just to be sure. The results were unclear, so he was sent for a catheterization, which is a test that inserts a tube into the arteries to check for blockages. A mild narrowing was found and a stent was placed, but that night Raymond had a reaction to the contrast dye and developed kidney problems. He spent 6 days in the hospital and needed follow-up care for weeks. The fatigue never changed because it wasn't a heart problem to begin with. He was simply an older man who needed better hydration and more rest between meals. If you're over 70 and not experiencing classic cardiac symptoms like chest pain during activity, shortness of breath on exertion, or a significant drop in energy during light exercise, then a stress test may do more harm than good. A better option is often a resting EKG, which is a test that looks at the heart's rhythm while you're still, or even a coronary calcium scan, which is a low radiation imaging test that shows whether dangerous plaque is building up. These are safer, simpler, and far less likely to push you into a procedure you didn't need. Number 2, colonoscopy. You probably didn't expect this one, but colonoscopy, which is a procedure that uses a long camera to examine your colon, is not always a wise choice after age 70 and almost never recommended after 75 unless there are specific symptoms. The risks go up with age. The preparation is harsh, involving strong laxatives that can cause dehydration, dizziness, or kidney issues. The sedation used during the procedure poses added risks to brain function in older adults. And perhaps most surprisingly, the test itself can cause complications like bleeding, tearing, or even heart rhythm disturbances during sedation. A 2019 study in JAMA Internal Medicine followed over 1.3 million Medicare patients aged 70 and older. They found that for every 0.0 colonoscopies done in patients over 75, only 2 lives were saved, but over 20 people experienced serious complications. That's a 10-1 risk-to-benefit ratio, and even when polyps are found, many are small and slow-growing. Removing them in an older adult can sometimes do more harm than leaving them alone. Dana was a 73-year-old grandmother who ran a small bakery with her daughter. She had no symptoms, no bleeding, no changes in stool, and no family history of colon cancer. But her new primary doctor, fresh out of residency, urged her to get a screening colonoscopy. She agreed. During the procedure, a small polyp was removed and she was sent home. That night, she experienced intense abdominal pain and fainted. At the hospital, they found a bowel perforation. She spent 9 days in recovery, lost 10 pounds, and hasn't been the same since. When we reviewed her case, we found she had already had 2 clean colonoscopies in the past. There was no reason to repeat it. The U.S. Preventive Services Task Force currently recommends stopping routine colon cancer screening at 75 for most people. For those in excellent health, a stool-based test like the FIT test, which is a non-invasive fecal test done at home, is often a safer option. It has no prep, no sedation, and still catches most concerning cases. Ask your doctor about alternatives because once you're in the colonoscopy pipeline, it's hard to get out. And now we've reached the most overused, most dangerous, and most harmful checkup for seniors, and you've almost certainly had it done. Number 1, annual full-body CT scans. Full-body CT scans, which are sometimes offered as part of executive health packages or as preventive services in private clinics, are marketed as a way to catch cancer early. But here's the shocking truth. These scans expose your body to a high dose of ionizing radiation. For older adults, especially over 70, the risk of triggering unnecessary follow-ups, biopsies, and even surgeries is incredibly high. And the irony is there is zero evidence that full body scans without symptoms save lives. Each scan delivers between 10 to 20 millisieverts of radiation, which is equal to around 500 chest X-rays. According to a 2023 modeling study published in JAMA Internal Medicine, the rise in CT scans across the United States may now be responsible for up to 5% of all cancers, putting them on par with alcohol as a cancer-causing factor. That means 1 out of every 20 cancers could be caused by a scan that was supposed to prevent disease. That's not just counterproductive, it's terrifying. The scan can detect harmless nodules, calcifications, or cysts that are simply part of aging. But the moment they are seen, a red flag goes up. More scans follow, then biopsies, then panic. Let me tell you about Marcus, an active 80-year-old who used to teach martial arts to younger seniors. He felt great and took part in a senior elite checkup at a private clinic. His full body scan showed a tiny 3 mm long nodule that set off a chain reaction. He was referred to oncology, sent for a PT scan, and eventually underwent a needle biopsy. The result benign, but the biopsy collapsed part of his lung, leading to hospitalization and a 2-month recovery. All for something that could have been left alone. Experts now advise that full-body CT scans should never be used for general screening in asymptomatic adults. The American College of Radiology is clear. There's no proven benefit and significant potential for harm. If there are symptoms like unexplained weight loss, coughing up blood, or visible swelling, then targeted imaging makes sense. But scanning the whole body with no focus is like searching for treasure with a landmine detector. You may find something, but the damage could be worse than what you were trying to avoid. A safer, smarter approach is listening to your body. If you feel well, maintain regular checkups with your primary doctor and only do tests that are clearly indicated. Your time, energy, and health are too valuable to waste on fear-driven screening that could leave you worse than where you started. So, there you have it, 5 checkups that may seem helpful but can actually hurt, especially once you're past 70. Modern medicine is powerful, but it's not perfect. Sometimes less is more. Always ask, what happens next? If this test finds something, if the answer is unclear, or if the risks are higher than the reward, it may be time to pause. And remember, real prevention starts with lifestyle. Stay active, eat well, sleep deeply, and choose your checkups wisely. Now, we want to hear from you. Have you or someone you love ever faced complications from a medical test or treatment that turned out to be unnecessary? What happened? Share with us your experiences and opinions in the comments below. We'd love to hear them. Thanks for watching.